Community health relates to expanding our model of what it means to take care of people. It means that it's not just enough to look at those people who make the choice to come to a doctor's office, but we need to address health in a more broad fashion to really look at where people live and what impacts the decisions they make.
It's a really important time to emphasize community medicine in our title because the world of care is changing, and we are right at the forefront of identifying that change and being involved in it. Our faculty in our department have experience and expertise in dealing with community health issues for the last 25 years.
Medicine is really, I think, intertwined with family practice. Family docs have always practiced in the community, and so it's always been an important part of the department, and it's just grown over the past 30 years.
In fact, back in '73, I thought if you wanted to practice medicine, you should live in that community so you get better feel what's going on and what resources there are, and you can utilize them better. And the patients learn to trust us, and trust is an important thing when you take care of people. And I think, by the way, that's one of the strengths of the department now, that the faculty are trusted, and all the people that work there are considered friends, and the community has accepted family medicine too.
Over our 30-plus year history, that vision and model of community health within the Department of Family Medicine has evolved. So we've been able to attract funders from multiple sources, been able to find partners who care about these broad social issues, and of course been able to partner with communities to really create programs that have a measurable impact on the health of our public, not just for patients who are in the office, but for the communities in which they live.
I've had the opportunity through support from the Department of Family and Community Medicine as well as the hospital to explore these avenues further and bring a new staff on board with, again, a history of working in communities to help link the Academic Health Center with organizations and key individuals in communities that live there, worship there, play there, all those things, and how can we work together to improve the quality of life as well as the common health indicators.
St. Elizabeth's is located in north central Philadelphia and provides all different kinds of services, but one of the most critical services that it provides is health prevention and promotion, along with a clinic that's run by Jefferson Family Medicine.
St. Elizabeth's, it means a lot of things when you say it, but it's, to me, a neighborhood in lower North Philadelphia specifically that is in the process of a neighborhood renewal and empowerment process through their partnership with Project Home and with all the residents in the community who are working very hard to revitalize this neighborhood and make it a healthier place to live.
Well, Dr. Law is my primary care physician, and she sets up my appointments with me for all the specialists that I see about my physical needs that I have and my prescriptions and all that.
The mission of Project Home is to address root causes of poverty and injustice and to help everyone attain their fullest potential as human beings.
Chandler Hall is a Quaker community, and we provide a wide array of services from adult day to a child daycare program, to skilled nursing program. We have a specific ALS unit within the nursing home, that's Lou Gehrig's disease. We have a residential hospice as well as home care and home hospice, and an assisted living, a large assisted living population.
And Jefferson had strategically looked at developing their senior services, and their vice president of senior services knew the CEO here, and they got together and collaborated and thought it would be a good marriage.
My main role up at Chandler Hall is to serve as medical director, and what I do is I provide medical care as well as sort of administrative oversight for the facility in conjunction with the nursing home administrator. But the largest piece of what I do is provide direct care for the nursing home residents and education and support information for their families. I think one real unique aspect that Jefferson brings to the Chandler Hall community is by providing that academic atmosphere, the relationship with students, fellows, attendings, and really being on the forefront, sort of the cutting edge of medical care for geriatric patients.
The CORE project stands for Community Outcomes Research and Evaluation, and it is a grant that we have from the federal government under Health Resources and Services Administration. And the CORE project recognizes the need to evaluate and study and report on what we're doing in community health.
We recognize that to address this kind of research agenda, we needed to change our infrastructure. We needed to have greater resources, and we need to have an infrastructure that could reach out to the community and to build that bridge between addressing community needs, providing service that has an impact, teaching students and residents, but also asks and answers researchable, fundable research questions. So the role of CORE is really to create that infrastructure that would allow us to not only conduct high-quality research in the community, but also to build the kind of fundable programs that NIH and other federal and other sources of funding are interested in supporting.
Jeff Hope has morphed into I think, a culture on campus. It started out with students wanting to, provide primary care services to folks that may be in need. It's amazing each year to find a new group of students who take on an extraordinary difficult task of trying to manage this and keeping it going.
One of the more recent projects that we've done is a collaborative project with the Health Promotion Council of Southeastern Pennsylvania and the city's Department of Public Health, among many of us at Jefferson, to look at the problem of stroke, hypertension, and prostate education in African American men. In fact, we call it the Shape It project because the Stroke, Hypertension, and Prostate Education Intervention Team.
The physician shortage area program started in 1974. It actually began with the beginning of the Department of Family Medicine. It was started by Dr. Brucker and Dr. Gonnella, who was the associate dean at the time. And it's a program to recruit and educate students to practice family medicine in rural areas, primarily in Pennsylvania. Over the past 2 decades, we've studied the outcomes of the program, and we have 5 outcome studies published in the New England Journal and JAMA showing the program to be highly successful. The program also was supported by the Robert Wood Johnson Foundation, who supported us to write a book about it. And that book, Caring for the Country, was published in 2004, which really tells the story of the PSAP and then tells the story of 10 of the graduates who are in rural family practice now.
We're in Haddington this afternoon, which is a community in West Philadelphia between 52nd and 63rd, Market and Girard. And today we're performing a playground assessment as part of our project, looking at the impact that the built environment has on physical activity. It's part of the active living by design concept that if you integrate physical activity into people's everyday lives, you can ultimately impact their health.
I think more than anything, this is the first time we've really looked at the impact of the environment on people's health, and it's one of the first that's really looking at urban health and the impact of the built environment in an urban community.
Mazzoni Center is a health organization and an AIDS organization that specifically targets the gay and lesbian, bisexual, and transgender communities in Philadelphia.
The Mazzoni Center and Jefferson Family and Community Medicine have made an arrangement such that I can provide medical directorship, but also see patients and do clinical services here. Any private office or private practitioner would tell you that if they're opening a practice, there's a world of things they have to do and make relationships in order for all of their patients to get all the services they need. By coming in with Jefferson from the beginning, we've discovered that all those relationships have already been made. We're sort of piggybacking on those. And so all the referral specialists that exist at Jefferson are instantly available because they're through me. And that relationship is going to definitely benefit our population. We have, within walking distance, radiology services, lab services, all the specialists, and the hospital itself.
We're very, very fortunate to have the partnership with Jefferson because Mazzoni Center does not have the infrastructure
to provide all of these services, and were it not for Jefferson, we would not be able to expand our health center in the way we have expanded it now. So we're very, very fortunate.
Jefferson has been involved with the Philadelphia Senior Center in many ways for a long time, but beginning in the mid-1990s, the Senior Center staff became increasingly aware of the difficulties faced by their clients because of inadequate access to the healthcare system.
Jefferson has a health suite here and provides the medical care for a lot of our members and also for other folks in the community, which is really helpful to us because it drives a lot of traffic through our doors and people get to know us and get to learn about us, and it's really a wonderful marketing tool. Somebody can come to go to see one of the doctors at Jefferson and then recommend our center to their aunt or uncle or parent, so it's really been a wonderful relationship.
I think one of the most important parts about our relationship with the Philadelphia Senior Center is the opportunity we have to really impact the next generation of healthcare professionals. So over the 8 or 9 years of our formal relationship, we've educated over 1,000 healthcare students, all of whom have had an opportunity to learn at our sides and to learn from the seniors themselves. And for many of our students who are young people, it's really the first time they've had an opportunity to understand that older adults are not all frail and demented and delirious in the hospital, but really are leading incredibly rich and active lives in the community.
Sharon Baptist Church is made up of approximately 7,000 members. It started some years ago, almost 70 years ago, where Sharon Baptist started in a house with 8 people.
Our goals here in the Health and Wellness Ministry is really to educate, promote health and wellness throughout the entire congregation.
We have a community day every year, and in our community day is a health fair. The health fair has things such as diabetes, such as AIDS, such as cancer awareness.
We feel that people sometimes are not attracted to just health fairs. In the past, we've had blood drives and we've had stroke and heart health awareness programs, but oftentimes the community doesn't come to that particular type of event. So we made it a fun time where everyone can bring their family, and some people are getting their blood pressures screened and the kids are playing on the rides.
The home visit program has been running for about 15 years. It was started by 2 attending physicians at that time, Dr. Plum and Dr. Perkel, and we service about 90 home visit patients that are spread throughout the entire city of Philadelphia.
I first got interested in the health of communities when I began talking with patients about the impact that their lives were having on their ability to follow through with care or follow through with my recommendations. We were finding a whole host of folks who were missing appointments, and we would find out that they were actually admitted to another hospital. That's when we started the home visit program, to try and go into the communities, but into people's homes to get a better idea of who we were seeing and what the impact of their life and life situation was having on their ability to manage their illnesses.
This program serves 2 purposes. It's a clinical program to provide medical care for our homebound patients, but it also serves as an educational purpose to allow students and residents and geriatric fellows to go out to into the community and take care of patients in their home.
Jefferson has been partnering with Youth Emergency Service, or YES, we go by YES, for 11 years.
These kids are so vulnerable, so you have to be really careful about how we talk about their histories, how we counsel them, and to make sure we're working collaboratively with many providers, from social work here at YES to DHS to the families that they were living with, or the group homes or foster homes that they were, before they were here.
Jefferson provides our medical care, which includes physical examinations, health assessments, and will recommend follow-up care for any child needing that. And we also have some counseling services through Jefferson. By the fact that the clinic operates out of the shelter, it makes it just tremendously easier for us that someone is here, located here, doing the examinations, and we're not trying to transport 6 children every afternoon, every Monday afternoon, to some location, or waiting at a clinic, at a local clinic for hours at a time just to have one child seen, when we need to have all of our kids have physical examinations.
We expose our physicians in training to a model of healthcare that they don't have in other experiences. The idea that we can actually go out to the community as part of a big academic institution like Jefferson and be on the front line with kids that are facing really tough circumstances is a phenomenal learning tool. To be able to see how a physician figures how that fits into the rest of their professional life is important.
The benefit for all of us in terms of teaching and in community service is that when we go, we often see families with the least amount of resources that are doing a phenomenal job in caring for some of the most challenging patients that you'll ever see. And that is a service, and that's very rewarding as well as a teaching moment.
I think we all need to listen to what's going on, in the neighborhoods.
Jefferson brings such an academic, forward-thinking role to Chandler Hall. It's a marvelous relationship. Dr. Parks is a wonderful teacher, and she brings to our staff and to the management team just new ideas, inventive ideas, and a real structure to our program.
I've worked in geriatrics for a very long time, and it is very difficult to find one, a geriatrician, and two, a geriatrician that has experience in working with institutionalized residents. And so I think that those are two things that Jefferson brings to us, and that would be very difficult to replace if Jefferson and Chandler Hall weren't working together.
Jefferson Family Medicine and Jefferson Hospital has made a tremendous difference in our work because Jefferson brings skills and information and talent that really adds so much value to what we do, and it's talent and expertise that we do not have in-house at Project Home or in this neighborhood. But working together in a partnership, we can each bring critically needed services that separately wouldn't be as effective. But working together, it's much more effective to creating a healthy community.
So I guess from a very personal level, I think it does take some courage to add the name community to our name. But I also will tell you that that we need to share that courage and have that courage throughout the institution, because I believe that the academic health center that will be most successful in the next decade is the academic health center that figures out not just how to ask the basic science questions, not just how to provide outstanding clinical care, but figures out how can we take on the most serious and challenging obstacles that exist in improving the health of the public. We will not be able to do that without partnering with communities.